Hey, I'm Ashley Wittler, and I'm one of the women's health nurse practitioners. I began my journey in the women's health area as a labor and delivery nurse after I graduated from my undergraduate program. I knew that's where I wanted to be. That's what always made sense to me, and where I always found myself longing to be back in that scenario, was taking care of women in labor and pregnant women and helping deliver their babies. It was such a special time in their lives. So I knew I wanted to continue in that genre of nursing, but I wasn't certain what that meant for going on and furthering my education. And so I actually was mentored by one of our other nurse practitioners here at this office. Her name is Marla Smith. She was my first boss on labor and delivery, and she actually very much made a large impact on what I'm currently doing and at Heartland in the practice, and we're co-workers now. She went through school and I watched her, and she was a very hard worker and had a family and somehow juggled it all, and I thought, look at her, she's doing it, and she's doing everything she loves. And so that's what I decided to do. I decided to follow her footsteps, and I became a women's health nurse practitioner, and I've been in practice for 7 years, and I love it. Love that I still get to work with my old boss, but really love taking care of women throughout the lifespan. And I didn't know that there was so much more to it than just pregnancy. I really enjoy contraception counseling and talking about menopause and just taking care of women across their entire lifetime instead of just that one little snippet that I was involved in before. What I really love the most is that I grew up in this area. So the women that I'm taking care of in our practice and the community that I'm giving back to is the same community I grew up in, and helped take the time to teach me and help me grow and nurture my academics and my family. My family's from here too. So I think that's the most important thing to me about where I'm practicing, is that I have a special connection with our patient population. But outside of that, I also really enjoy the dynamics of having a population of a lot of women who actually need my help. A lot of practices will find sort of obsolete kind of routines for providers, and I don't feel obsolete here. I feel very essential, and I feel like what I'm doing definitely is impactful and makes a difference for my patients. My karaoke song would probably be Friends in Low Places by Garth Brooks. It's a good one. Everybody seems to know it and can chime in. A close second would be anything by John Mellencamp. My favorite place I've traveled to by far has been London. I went in 2008, and it was gorgeous. My husband and I went for our first anniversary, and we had a great time. It was just the two of us, and the people there were so welcoming and friendly, but also all of the historical information that you learn along the way. Like, everything is just filled with so much history, and you just felt very special to be a part of that place and that time, and be places that great kings and queens, you know, once walked. That was very cool. I wanted to be an orthodontist when I grew up. And I did not make it that far. Whenever I went away to school, I was pre-dental, and I took a physics class that was really, really tough, and I didn't do so well in the class. I ended up pulling off a B after a lot of tutoring and a lot of help, and it just wasn't enough to get me into the School of Dentistry. So I was very upset about that, and I went to my dad, who has always been kind of my rock and the person who's been there for me, and he said, I think that you would really do well in nursing. I think you'll always have a job. I think you'd really like it. And so I did. I kind of followed what my dad said, and I applied to the School of Nursing. I got in, and I didn't really like it. It wasn't for me. It wasn't my thing. And then I hit my OB rotation in school. And as luck would have it, the person who taught me is now the head of the nursing program that I'm working on my doctorate at SIUE. And she inspired me, and I hit my clinical rotation, and I just loved every minute of taking care of laboring women and helping bringing babies into the world. And that was it for me, hook, line, and sinker. That's the only thing I ever wanted to do after that. Any rotation that we got to choose what we were doing, that's where I was, hands down.